Hello and welcome to Nursing with Koi. My name is Wangui Mwangi. I do videos on nurse education, patient teaching as well as health education, and today I come back with a video on introduction to midwifery, and I'm beginning a series of 10 episodes starting with episode 1 of midwifery. So the whole series is about midwifery and I will cover it in 10 sessions. So let's dive right in. Hello and welcome to my YouTube channel. My name is Wangui Mwangi and I'm a Kenyan RN. I do videos on nurse education, patient teaching as well as health education. And today I come back with a video on a new series I'm starting. And this series will be on midwifery because we are both nurses and midwives. So we are going to do this in 10 episodes. So this is episode number 1, which is introduction. Let's dive right in. If by chance you haven't subscribe to this channel or you have just come and found it for the very first time, please take your time to subscribe and hit the bell icon so that you're notified every time I upload an informative video such as this one. And if you're a returning subscriber, know that I deeply appreciate you. So let's see. So as not to get overwhelmed, I'm just going to define 3 terms, and the first one is midwifery, and this is the care of women during pregnancy, labor, the postpartum period, as well as care of the newborn. A midwife is a professional in midwifery of either gender, and usually they hold an important key to positive care at the time of childbirth that will contribute to a good start for the baby and the parents. Another term is certified midwife or certified nurse midwife, SCNM. And certified nurse midwife here in Kenya, they are also called KRCHN, Kenya Community Registered Community Health Nurses, because they are also certified to practice midwifery. So this is a nurse who has received training in midwifery and has trained in many aspects of comprehensive women's health care. So midwifery is the science and health profession that deals with pregnancy, childbirth, and postpartum period, including care of the newborn, and in addition, the sexual and reproductive health of women throughout their lives. So it is also important, if you're receiving any services to do with midwifery, to remember even family planning and contraception and any counseling that comes thereby should be provided to you during care within that department. Midwifery encompasses the care of women during pregnancy, labor, and the postpartum period, as well as the care of the newborn, that I have said again. And it includes measures aimed at preventing health problems in pregnancy, detection of abnormal pregnancy or conditions, and the procurement of medical assistance whenever necessary, and the execution of emergency measures at the presence of medical help. So what, in very simple English, it is just meant to take care of this woman, observe her, treat her as a human being like she is, and in the event that something has been noted that is not within the normal, then the patient is attended in a hospital, either in a healthcare settings, either a dispensary, a health center, that whole level of referral. Every level has trained personnel to handle a patient or a mother experiencing pregnancy, or with a new child, with a newborn, or who have just delivered or who is just going to deliver. So we have trained personnel from level 1 all the way to level 6. So all you need to do in the event that you have this, it is to seek health care if and when you need it. In very simple English, the standards of midwifery is just to ensure that there is good outcome to both the mother and the baby, meaning we end up with a happy mother receiving a healthy, happy baby, and they're able to continue with life because that is where they're at, and they're also able to cope with different scenarios even if they arise. So midwives are responsible and accountable professionals who works in partnership with the women to give necessary support, care, advice during pregnancy, birth, and postpartum. The midwife conducts birth on her responsibility and provides care for the newborn and infant. This care includes preventative measures, the promotion of normal birth, the detection of complications in mother and child, the accessing of medical care, or appropriate assistance in caring for emergency situations. The midwife has an important role in health counseling and education, not only for the women but also for the family and the community. Very, very important, because in the African society we know that the child does not belong to only the woman but belongs to the community, belongs to the entire family, and therefore they have a stake to play. This work should involve the antenatal education and preparation for parenthood, sexual and reproductive health, and childcare. Very, very important, especially if it's a new mom who has just experienced pregnancy. Sometimes it could be a teenage pregnancy, it could be an unwanted pregnancy, an unplanned pregnancy, but all the same, we provide care with love and prioritizing the patient's past. And this time you have two in one, and therefore you take care of both. A midwife may practice in any settings, including home, community, hospitals, clinic, or health units. It is very important to know that nowadays we have midwives who are called doulas, and these are specially trained midwives who can provide these services at the comfort of your home. They work with you along the pregnancy journey, and they give you advice, and they can be able to deliver that child even at the comfort of your living room or whatever room you choose, and that is able to be facilitated because you are empowered with that knowledge and you have medical help if it is needed. Any system that is growing, it is important to have a self-perpetuating growth, and how midwifery ensures continuity of care. There is a model, and in this model is where we have new graduates and students, and they have their role to play. And then we have those managers and those very seasoned nurses or midwife. So they all have a role to play in ensuring that midwifery skills and competencies are passed along and the general public or community get the best of the care. So on the sides of new graduates or nurses, they seek continuity of care and experiences. They have to garner enough evidence and of having done experiences of different sorts. As a nursing student, you will be required to at least observe 10 deliveries before you can even go near labor ward. And then you observe 30 deliveries, then you are able now to start. Again, you will be required to do another 30 before you can go for your assessment to show that you have achieved these competence skills in midwifery. Then you also have to access a mentor. You're required to be mentored because there are so many things that do not happen in theory, or you are told in theory but they don't translate to practice immediately. You have to be shown, be apprenticed into the practice. Then develop professional boundaries. Very, very important to know this because you need to know what you're competent to do and what you need to refer and when to ask for help and when to say I am overwhelmed, because it is very important. It could mean life or death of two people. Another important thing is that they engage these young nurses or the students, they engage in reflective team meetings, including obstetricians. So in the nursing school and setups in the clinical areas here in Kenya, we have different ward rounds, especially when rotating in the maternity department. It is very, very important to attend those rounds because during those rounds you're going to even continue learning, because you will be a number of students joining in the bigger team of doctors and those who are aspiring to be doctors or their students themselves, and then the consultants will be there, the seasoned nurses will be there. So there will be a wide array of people who can actually show you and teach you properly to mentor you to enter into the field of midwifery. So once they now continue with that process, they are going to become nurtured, they're going to become more experienced, and they will become seasoned midwives. And midwives, again, you need to note that it goes either male or female. You can be a male midwife, you can be a female midwife, because the act of midwifery, it's the oldest profession in the history of human beings, because since when Eve gathered the Garden of Eden, when we had Eve and Adam, we were told childbirth will be experienced and it will be painful. And therefore, I don't know how Eve did hers, but for the rest of the generations, there is always somebody who is there to assist the woman as she struggles with the giving birth. And I think that is why that title appeared to be a midwife, because then it used to be the role of women, but eventually it has been, it is for both genders basically. Anybody can be a midwife nowadays, despite your gender orientation, sexual orientation. Then we have the things that we need to do now that we are becoming seasoned and we are now still going through school. We need to build relationship of trust through high level of continuity of care. Your patients need to rely on you. They need to know that you're not going to abandon them. They need to know you're not going to panic. They need to know that you're not going to drop anything because they are relying on you to help them in their time of need. Providing support and mentoring from within a small group of midwives, very, very important. And the labor ward is one of the places you will find the best people to teach you because they are always willing to teach you if you're willing to learn. Then we have to prepare graduates to work in the midwifery and continuity care models. Very important because if we do not get enough midwives, the factory is going to close. But anyway, we are not going to get there because we have people always willing to learn more and to specialize with midwifery. So on the managerial sides, they have to provide these mentors to mentor the younger nurses, the younger graduates, the student nurses, then provide longer orientation and initial reduced caseload. Very important because if you're new in the department, you need to take time to actually garner those competencies before you can actually allow a person to rely on you heavily for their care, because these are two lives and this came in healthy. You want them healthy at the end of that pregnancy, and you need to know that you know what you are doing. Then another thing, 6 students to work in the models. Again, there was a call by the KMTCs encouraging people to take up nursing and to join nursing school or to apply because the numbers have gone down, but we still keep needing more midwives, more nurses in the profession. Then we have to address organization cultures. Very important because this is something that has made milestones in the nursing and midwifery profession, and we have grown through organizational culture changes. So there are different types of midwives, and this we can say without fear or favor because midwifery has existed since man was invented or was created, and since childbirth has been there and it has been perpetuating itself, and that's how we came into being, then we have had it. But then during the 1970s, there were 3 categories of midwives. 1, granny midwives, 2, lay midwives, and 3, traditional birth attendants. This was because, if you remember, there's a video I done on history of nursing in Kenya, and I think I might redo it. I may have deleted it. But in this video, we remember when formal nursing actually began in Kenya. It is around the 1970s. So granny midwives are those very old midwives who have grown out of the profession, but they were self-taught or they learned from someone through apprenticeship. So granny midwives. Then lay midwives are those who can assist despite the fact that they don't have so much experience, but they are just practicing. Then we have traditional birth attendants, and traditional birth attendants have been taught through apprenticeship. Even currently in some communities, we still have the traditional birth attendants, and these are women who have a lot of experience delivering babies the natural way. Then when we got formal education, this improved a lot, and a lot of aspects in midwifery changed. And then we got exactly 2 types of midwives. One is a certified nurse midwife, and this is what I said. Nowadays, we're just calling them KRCHN, Kenya Registered Community Health Nurse. Even if you're doing BSN, at the end of the day, your title will be KRCHN, and then there will be stroke BSN. And then if you're doing a diploma, it will be KRCHN, because you are a registered community health nurse. And what this means is that you have been taught in all those areas, including you can do medical surgical nursing, you can specialize further to any other field, but you are also competent as a midwife. So the role of the midwife is quite diverse, and the midwife has to collaborate with a multidisciplinary hospital team, and this includes the obstetric services, the neonatal services, nutritional support services, medical services, domestic abuse services, welfare services, mental health services, pharmacy services, community support services, family planning services, and the physiotherapy department. Sometimes you will need all the departments, including occupational health, because sometimes there will be a reason for you to involve everyone. So the midwife in a birth center will have different roles, and there is one in the practice. There are those who work in the outpatient side, and this is in the clinic called MCHFP, Maternal Child Health and Family Planning. So these clinics usually have, now in our Kenyan settings, they usually have around 4 clinics in one. The first one is usually the pregnant mother clinic, the maternal care, where we provide antenatal clinic services. Then we have well baby clinics. Then we have postnatal clinics. Then we have family planning clinic, all in one. Sometimes this department will have minor surgery services to provide maybe screening for cervical cancer, cryotherapy, lip, all those services. They can be provided again in the same MCHFP. The place you go when you have now delivered, you still want care of your child for vaccination, for immunization, it's called the CWC, or the Child Welfare Clinic, and that is where we attend, and you have to collaborate with the people you find there. But really, the point is to provide holistic care. Those are still midwives you will find there. Then we have midwives who work in an inpatient setup in the maternity wards or departments, and again the maternity unit will be divided into the labor ward, antenatal, then labor ward, then postnatal, then nursery. There must be a nursery because there could be complications. The baby could come early, there could be some issues with the newborn, and therefore it is usually in the same department. Sometimes we also offer in the inpatient during delivery. There are those family planning methods that are provided within 24 hours after delivery, or within 24 to 48 hours, and therefore it will still be inclusive. So basically, what those nurses can do, even those ones at the MCH are still midwives. The same case with these ones, because they are still providing services to the mothers and their babies. It is very, very important to have a good understanding of midwifery and to appreciate what midwives do, because 83% of all maternal deaths, stillbirths, and newborn deaths could be averted with midwifery care. And this includes family planning. Because if it's an unwanted child, it's an unwanted pregnancy, it's a teen pregnancy, it's a very early pregnancy, it's pregnancy out of rape, out of those domestic abuses, then this care could be provided way early. And that is why close to the maternal child health and family planning clinics, you will always find a youth-friendly center or a VCT attached. Sometimes you will find an MCHFP, close by there will be a VCT, close by there will be a CCC. VCT is voluntary counseling and testing of HIV/AIDS, and then CCC is a comprehensive care clinic, and this one is for those people who are found to be positive and they get their services very close by. So when you're doing antenatal care, you have to take care of everyone holistically. For example, if you attend to a client who probably has other comorbidities apart from being expecting, you have to highlight them as high risk and monitor them in all aspects holistically to ensure that that pregnancy ends with a happy mother, healthy baby, and everybody goes home where they came from, and you get new clients at the end of the day. Then 87% of the services can be provided by midwives when educated to international standards. It is so sad looking at statistics of how many healthcare professionals there are compared to the general public population. So if you are to rely on gynecologists and obstetricians alone, they are going to be so overwhelmed because they are not enough. Probably one is serving a population of over 100,000 Kenyans. So if you need care now, it doesn't matter who it is coming from. At that point, you need care now. So that is why if you empowered the midwives even more, and this has been realized with a campaign called Beyond Zero campaign, This is a very important campaign because it has invested a lot in maternal health services, the MCH services, the labor services, because sometimes a woman will die because they do not have transport to get them to the hospital where they're supposed to get help in deliver. And probably they've had complications the traditional birth attendants in their village could not attend to. It is so sad, even now in 2021, we have an expectant lady wanting to go to hospital, but they have to go on hospital on a motorbike or on foot or carried by people. That really happens. And until these things and these systems are working better, the more midwives we have and well-trained, and the more well-trained they are, the chances of survival will get better and better. So nurses and midwives account for nearly 50% of the health workforce. So, and this is globally, basically. Anywhere you go in any health center or in any hospital, you will find that half of the employees in that hospital are nurses or midwives. And since in Kenya the program is now holistic, most of the students going for direct entry programs, they have to do the midwifery aspects. Then nowadays we have a lot more nurses who are midwives, and therefore nurses who can work all around, because again, even nurses, we have about 37 nurses for every 1,000 Kenyans. So assuming we have 1,000 hospital beds here and now, we can only find 37 nurses at one given time to attend to that 1,000 people. So you can imagine how stretched that is, because according to the World Health Organization, the ideal number of nurses to patients, that nurse-patient ratio, it should be 1 nurse, 6 patients. So if you divide 1,000 by 37, you will see there is a lot of shortage, a lot of short staffing, and a lot of cutting corners here and there, and this can be very detrimental to the safety of the population itself. So we need more and more, because nursing care is never enough. We will still need more and more nurses. I am a nurse. I would want more and more nurses to get trained and to get absorbed within the system to make the healthcare system even better. So the global strategy on human resources for health, Workforce 2030, and the global strategic directions for strengthening nursing and midwifery, that is 2016 to 2020, provides a robust WHO strategic response to develop nursing and midwifery as it outlines in the critical objectives that I'm going to share. So the clinical objectives are as follows. So the strategic directions are organized according to the following 4 thematic areas. 1, ensuring an educated, competent, and motivated nursing and midwifery workforce within effective and responsive health systems at all levels in different settings. Number 2, optimizing policy development, effective leadership, management, and governance. Working together to maximize the capacities and potentials of nurses and midwives through intra and interprofessional collaborative partnerships, education, and continuing professional development. And finally, mobilizing political will to invest in building effective evidence-based nursing and midwifery workforce development. So these were the references that I used for this presentation. Thank you so much for watching. So thank you so much for watching through this video, and this video is actually an appreciation to the Beyond Zero campaign, because I have seen what they have done. I have felt this as a midwife, and I remember when we got free maternal services in Kenya nationwide. That was one of the biggest milestones that we experienced. And then we got a lot more patients coming in and getting qualified as in health services for their delivery services. And I remember when that announcement was made, most of us, I was in a midwifery department at that time, I was in a maternity department, and we were overwhelmed because of the numbers of people who came, because that announcement was made, and boom, like this, we used to deliver like 2 or 3 mothers that night, as in a shift each, but that night we all had more than 13 patients to deliver, or who delivered, or to take care of. And you can know how that can feel by the time morning is getting there. If you have to take care of 13 ladies in labor and then take care of them postnatally. It is not easy. But then the Beyond Zero campaign really has come through. We hope more strategies and more people will donate into that fund, and that fund will be used rightfully for the women, because it is still unacceptable that a woman will die because they carried life into this world but could not access services. Thank you and bye.